Will the committee supply please come to order? This section of the committee supply will now resume consideration of the estimates for the Department of Families. Question for this department will proceed in a global manner. The floor is now open for questions. The Honorable Minister.
Sorry.
I apologize. It has to go to the Honorable Member for St. John's.
I think that the minister probably has some stuff she wants to share from last time, so I'll let the minister go first.
The Honorable Minister of Families.
Thank you, Mr. Chair. We'd ran out of time during our last session to get to the answers about how Manitoba funded Peguis First Nation. So I'm pleased to share with the member that for last fiscal, Manitoba provided $11.35 million, which reflects the amount the agency received when it was providing service under provincial law. And then this fiscal year, we're providing Peguis First Nation with $10.8 million. The lower amount reflects the fact that some cases of the non-Peguis First Nations have been transferred to the provincial system, and there are fewer cases, if you will.
The Honorable Member for St. John's.
Miigwech for that. So I kind of want to go back to numbers. And for the life of me, I don't remember where I put my notes. I had jotted everything down, but they are somewhere between caucus and my office downstairs. So I kind of want to get a better sense of, I think the numbers that you had quoted, or the minister had quoted from March 31st of 2022 was like 9,100, give or take, if I remember correctly. I want to spend some time to understand how those numbers come about. If there are different categories of children, how that works, post-majority children, if they're included in those numbers. I really want to get a sense of how that operates.
The Honorable Minister of Families.
Thanks. So to recap, last week I'd shared with the member that there were 9,196 kids in care. That is between the ages of 0 and 18. That includes all different types of care, whether that be foster care, under a kinship agreement, group care, or receiving care at an emergency placement. What that does not include is the 1,124 young adults that are receiving service through a young adult agreement. And during the pandemic, we had advanced over $7 million to ensure that kids weren't aging out of care, and we were extending those supports beyond kids who have reached the age of 21. And last month, we had announced, after the budget, we had announced an annualized fund to ensure that kids could receive care up to the age of 26. We wanted to mirror what was happening with the federal system, where kids could receive supports up to the age of 26. And so we've paralleled the provincial system to reflect that. And so right now we have 1,124 kids on an AYA.
The Honorable Member for St. John's.
So, and again, we don't know what the numbers are this year. You're hoping to get them relatively soon, but let's just operate from the 91, 96. So that's kids in foster care, kinship agreements, all group homes, emergency placements, and then 1,024 for young adults. PEGWIS. So the numbers for children that are now under the coordination agreement with PEGWIS, are those included? I mean, I assume they would still be in this number, but moving forward, will those numbers be included in the overall or no?
The Honorable Minister of Families.
They will not. When an Indigenous governing body signs a coordination agreement and those and they assume jurisdiction, their children in care are not counted under the provincial system.
The Honorable Member for St. John's.
And I believe you gave me these numbers, but I can't remember for sure, but when PEGWIS signed the coordination agreement, how many children were taken out of then the total numbers for Manitoba children?
The Honorable Minister of Families.
Just over 400.
The Honorable Member for St. John's.
And so any child that comes into care, there's not, and I know, again, you said kinship, foster, group, emergency placement. There's not different categories. So a child comes in, whatever, they're in a group home. There's not different categories for those numbers. Like some children could be considered like not part of the numbers, the provincial numbers. I don't think I'm being clear. Let me be clear. Any children that have contact with CFS, let's just put it that way. Any children that have contact with CFS, are there some children that would not be counted towards the total number of children? If that makes sense. I'm trying to make sense.
The Honorable Minister of Families.
So children in non-paid care are not included in the total number, and they're reported separately. And what that means is that children in the own home placement, meaning that they are back with their parents, and they are there's circumstances that they're waiting for, whether it be a court order to revoke permanent guardianship, to revoke that, and it takes a while for the courts to provide that. But at that point, the parents are not receiving per diems for their children, and that's why it's called non-paid care. Those kids are not in these numbers.
The Honorable Member for St. John's.
So how many children are we talking about? And when did that start?
The Honorable Minister of Families.
So for last year, that accounted for 560 children in own home placements, and the reporting mechanism came into place in 2018-19 to ensure consistency in all agencies were to count in the same manner, to provide reports in this manner, and we've outlined them in our annual report each year since then.
The Honorable Member for St. John's.
So the 560, and again, we're still operating on the March 31st, 2022. So, but is that a cumulative number, or is that just for 2022?
The Honorable Minister of Families.
It is a point in time. So the number as of on that March 31st date.
The Honorable Member for St. John's.
So, just bear with me, I'm trying to get a... So in 2018, 2019, there was a new counting mechanism that was kind of rolled out, and that's across the province. What would be the numbers if so, and this new kind of, like, for a lack of a better word, criteria, so own home placements, right? And so for 2022, we saw 560 come off the provincial total. I'm not sure if you would have those numbers, but what would it have been like in 2020, 2018, 2019, 2019, 20, 2020, 21? What would those numbers be?
The Honorable Minister of Families.
We're going to endeavor to get those numbers within the next hour or so.
The Honorable Member for St. John's.
While we're getting those numbers, if it's possible, is it possible to get the numbers in its totality from 2015, 2016, up until, again, March of 2022? So by that I mean, so yes, these own home placements, but of course that just starts at 2018, but the provincial numbers, starting from like 2015, 2016, each year, if possible.
The Honorable Minister of Families.
Okay, I think what might be very helpful for the member, because this is there was two separate tracking systems. So what it might be helpful is if I read into the record the number of children in care each year, starting from March of 2008, going up to March of 2022. And then I will indicate the year break between March in 2017 and March of 2018 is when consistently thereafter no in-home kids were counted. Prior to that, between March of 2008 and 2017, I am unable to get the number of in-home kids in care because they weren't tracked. So starting in March of 2008, we had 7,837 kids. Go slow. Okay. March of 2008, 7,837. March of 2009, 8,629. March of 2010, 9,120. March of 2011, 9,432. March of 2012, 9,730. March of 2013, 9,940. March of 2014, 10,293. March 2015, 10,295. March 2016, 10,031. March 17, 10,714. March 2018, 10,328. March 2019, 10,258. March of 2020, 9,849. And March of 2021, 9,850. And March of 2022, 9,196.
The honourable member for St. John's.
Okay, so to recap, up until 2018, so the March 31st of 2018 would have included or wouldn't have included the home, own home placements?
The Honourable Minister of Families.
2019, when there were 10,258 kids in care reported, was the first year in which the in-home kids were not counted.
The honourable member for St. John's.
So before I get to some of these numbers, like what was the rationale in 2018, 2019 to remove own home placements from the overall number? And I know that the minister had said there were some things that were, you were waiting to revoke permanent guardianship, whatever, but But typically and historically, they had been considered part of the overall numbers. So how did that new direction kind of come about, and what was the rationale for that?
The Honorable Minister of Family.
So when the decision was made to count kids who are in-home and receiving in-home care by their parents, it was a move towards counting the number of children who are receiving supports in-home but are well on their path towards reunification with their families and are receiving varying levels of support, but we know that there's a solid and strong reunification plan in place. We would like to see those numbers continually increase. Unfortunately, since we started counting those numbers, and as I mentioned earlier, there wasn't a consistency to the numbers of in-home arrangements prior to the move that was made in the 18-19 fiscal year. But I can say for the last 4 years, the numbers have fluctuated, but there is a bit of an upward trend. So in 2018-19, that number was 420. In the following fiscal of 19-20, there was 527. The next year, a decrease down to 379. And then the fiscal year ending March 2022 was back up to 560.
The Honorable Member for St. John's.
I'm just struggling to understand that if these children were still within the system, why they were taken out of the total numbers. I don't understand why those numbers other than to make it look like numbers are going down, right? Because if we look at, let's say, 2022 numbers, so, oh brother, if we look at 2022 numbers, I mean, they're going down, but not, and I know that the minister has repeated in the House that, you know, the numbers have gone down substantially, but they're not. But if you put those numbers back in, the decrease, which, let me just say for the record, is a good thing, certainly, right? Like, we want children to be with their families ultimately, right? But the number, the decrease in the overall number, provincial numbers for children in care aren't as significant as one would be led to believe if those numbers were still included. And again, I'm struggling to understand, you know, the rationale as to why they would be taken if they're still in the system.
The Honourable Minister of Families.
So in 2000, when the change was made, it was made after the authorities and the province had worked together at a consistent definition of what constituted a kid in care. So the definition that was agreed upon when these changes were made read as follows: that they were under the age of 18, placed in care by a CFS agency, that they were under apprehension, a permanent ward, a temporary ward, under a voluntary surrender of guardianship, or under a voluntary placement agreement, and or whose care needs are financially supported by government. So the in-home kids weren't always necessarily meeting this criteria. And so they weren't receiving financial aid necessarily from the province, and they weren't in the care of a CFS agency. And so the authorities came together with the province and agreed upon this new definition of what constituted a kid in care. And the numbers do fluctuate, and I do recognize where the members coming from in terms of grappling with these numbers and trying to see whether or not we are headed in the right direction with fewer children in care and decreasing the extent to which the child welfare system has in many families' lives, which is certainly what the goal of the department is and the goal of the province is, to ensure we are supporting families towards prevention and apprehension. So I think what might be helpful as well is just to read a few other numbers, the number of apprehensions by year, and the member can see how it fluctuates, as well as the number of family reunifications, and that might be helpful in terms of creating that fuller picture in regards to the child welfare system. So the apprehensions in 14 and 15 were 3,438. The following year, in 2015-16, it was 3,597. The following year, it was 4,176. 17-18, 3,797. In 18-19, it was 3,582. 19-20, 2,859. 2021, 2,314. And 21-22 is 2,175. And so let's also compare the number of reunifications per year. For the same years, in 14-15, there was 2,419 reunifications. 15-16, 2,715 reunifications. 2016-17, 2,586 reunifications. 17-18, there were 2,814. 18-19, 2,776. 19-20, 2,406. And 20-21, 1,856. And 21-22, 1,611. And so from these numbers that I've provided, which I believe are in our annual report, it's easy to see the downward trend of apprehensions, and that the reunification work continues to progress and proceed. And certainly we recognize that more work needs to be done in the reunification. In all cases, I think these families are all supported with greater investments from the province in respite and in other preventative measures that we will continue to invest upon until we see these numbers be, more reflective of a transformed child welfare system.
The honourable member for St. John's.
Thanks for that, those numbers. So and again, I'm just taking some quick notes here, but I have a bunch of questions. Who initiated the discussion with the authorities to change or revisit or reimagine or revision the definition of a child in care? I'll ask that one first.
The Honorable Minister of Families.
On February 10th of 2016, there was a change to the way Manitoba counted kids, and at that time, then Minister Carrie Irvin Ross had announced that voluntary placements would no longer be counted in care. And there was a 1-year period where that was the methodology that was met with opposition from community and the authorities and the care providers. And so a working group was struck at that time to come up with a consistent approach to counting, to providing counts in the CFS system. And so kids that were in voluntary placement were certainly put back into the methodology for counting, but then that is this working group's recommendation at the end of that was to include all kids, voluntary or otherwise, in the statistical data for kids in care, and then recognizing the differential with kids in home care that were already on their path towards reunification.
The Honorable Member for St. John's.
Okay, so starting in 2016, there was a working group, and then brings us up to the new definition. So that working group was doing that work. Who was a part of that working group?
The Honorable Minister of Families.
The working group comprised of members of all 4 authorities, Southern, Northern, Métis, and General Authority, as well as representatives from the Department of Families. There were no political appointees on this committee. The minister was not part of the committee, nor were any political staff a part of this committee.
The Honorable Member for St. John's.
So I want to just kind of go back to the numbers here. I appreciate that history. That's really important to know. So, and again, you know, I think that the definition and that history is actually, let me just ask one more thing. So I'm assuming that the recommendation would have come forward in respect of this new definition. Were there several definitions that were provided, and was it the department, was it the minister ultimately that decided like yay or nay this new definition? Like, how did that work? And was it that everybody, like the 4 authorities and government representatives, all kind of like, you know, based on consensus, developed this definition? Were there a couple definitions?
The Honorable Minister of Families.
I have to admit that neither myself nor my team was on that working group at the time. And so I don't have that history to provide the committee on the how that committee was structured and how they dealt with their recommendations. What I can say is that the new definition was reported in the annual report, which the annual reports are always signed off on by the Deputy Minister and the Minister of Families. And so that's the ultimate approval that would have come from those signatures that would have gone onto the annual report and been reported. All the totality of the recommendations that came out of the working group, I do not have them at hand.
The Honorable Member for St. John's.
Miigwech for that. I don't even know what I did last week, so I can appreciate that that was a couple of years ago. So I just want to kind of revisit the numbers because again, I want to recognize that this was apparently recommendations that came out of the working group. And I'm just raising this, and I'm sure that the minister is aware why I'm raising this, because the minister has taken many opportunities to say that the numbers have gone down. And of course, if you look at this new definition, then the numbers have gone down, right? But if we add those numbers, which have traditionally always been a part of those numbers, right? And again, starting from I think we would have said 2019 was the first year reporting that, I believe. So if we add the 420 back in, that's 10,678 children in care. If we add the 527, that's 10,229. If we add the 379, or that's for 2020, 2021, if we add the 379, that's 10,229. So, and then 2022 is actually the first year, even with those numbers, if we put back those numbers of 560, is actually the first year that we see a true decrease in numbers. Do you see what I'm saying? Because when we talk about the numbers, the overall provincial numbers, and I understand why the minister would say that the numbers are going down. On the surface, it looks like it's going down. But when you put those numbers back on, actually the numbers got worse from because the minister will know that, often folks will say, well, the NDP did this and did that, and I'm not here to disabuse or have that argument here in any way, shape, or form. But if we were to say in 2016, so March 31st, 2016, which was really at the end of the NDP era, there was 10,031 children. But that included the numbers that are now taken out, right? So I kind of just want to, I want to put that on for the purposes of Hansard and for the record here, that it's not entirely accurate that the numbers have been going down each and every year. In fact, 2022 is the first year that we can say the numbers have gone down. So I don't know how the minister feels about that, and I think it's important to recognize that it's not really comparing apples to apples then when we talk about what. And again, let me just say this: at the end of the day, we want less children in care, right? That's the ultimate goal for all of us, I imagine. It doesn't matter where we sit on the side of the house. We want children, we want less children in care. We want them with their communities. We want healthy communities, healthy families, healthy children. We all want that, I would imagine. But my concern is that when we go out into the public and say that, the numbers have steadily been decreasing year after year, it's not the same comparison, because the comparison into previous years included these numbers that now no longer include those numbers. So I just wanted to put that on the public record. I had a meeting on Friday with a bunch of agency directors, including my own director for Sagin, who I absolutely love. I think Frank Daniels is a good human being, loves our community, loves our children. And so every opportunity that I get to support and hang out, and I once was a judge for karaoke, which is actually a lot harder for within the families in CFS. It's a lot harder than you would imagine. But all of the directors, there was a common theme, and what they talked about was the need for prevention dollars. And what they also shared was that the prevention dollars that they do get fundamentally or primarily come from the feds, and that there is not a significant level of dollars for prevention that comes from the province. So I'd ask the minister to comment on that.
The Honorable Minister of Families.
Thank you. And of course, we are going to split hairs a little bit about the number of kids in care, and really I do want to point out the trend line that we are moving downward, regardless of even when the own home kids are in the count. And I'd also want to point out that there wasn't a consistency in the numbers reported prior to the change in 18-19. And of course, as we know, there was a year in which voluntary placements were taken out of the system. And so the way kids are counted in the system was not consistent. And what I can say is that it has been consistent for the last 4 fiscal years. And we do see a significant reduction in the number of kids. Do we have a long way to go? Absolutely. Do we want to continue investing in prevention and supports for families? That is absolutely what we're going to do. And so in regards to the conversations that the member had with those on the front line, I appreciate the feedback that was received from those agencies and the authority. And I think what might be helpful is for me to just put into the record the funding for Southern Network. And of course, if in subsequent answers, if you'd like me to read into the record the numbers of dollars given to the other authorities, I'd be happy to do that. But their total funding for 23-24 is $170.4 million. Of that, and so the new funding in their envelope includes $2.3 million, which is a reallocation from case transfers. So if kids came into the general authority, initially those dollars would go to the general authority, and then we would ultimately reconcile and flow those dollars out of the general authority over to the Southern Network. So they got $2.3 million for that this year. The cost of the inflationary costs, we provided $3.3 million in inflationary costs, an additional $3.5 million for increased salary and operations. And then this year, Southern Network, we also provided $1.4 million for national standards. This is to reflect that the new standards have come into place where family priority, kinship and community placement is a priority, and there are certainly extra expenses at times to go with those standards. So we provided $1.4 million. So that included a total of $10.6 million more this year than previous year. And then in addition to that, we did support for young adults of $2.5 million for 23-24, and that's to reflect that kids can stay in the system longer till age 26. And then we enhanced, we did a one-time wage relief for the Southern Network, and that amounted to $5.26 million with recognition of that the wages hadn't changed in a while. So in total, a total of $27 million is committed towards supporting the CFS sector, which include $13.9 million in increased allocations for agencies and up to $11 million in one-time funding to address those retroactive wage pressures. And the Southern got the 5.2, as I stated. We also gave 2.4 to First Nations CFS authorities to support the implementation of the national standards, of which Southern got 1.4 and the Northern Authority got 1 million of that to support those national standards, including customary and kinship care. And then over and above this, we did provide that $4.6 million for youth exiting care that was allocated in this year's budget. In regards to multi-year funding through for prevention, I'll just name a few initiatives. We provided $369,000 more for Street Reach Winnipeg, $900,000 for Street Reach North, $68,000 for Clan Mothers, $1.5 million for the Nichiwam Eagle Embracing You initiative, which a member probably knows it's an Indigenous-led treatment facility to support sexually exploited youth. $250,000 for the consortium led by Mum Away, the Community Helpers Program, and $400,000 for respite in that's called Granny's House, that is organized by Blue Thunderbird Family Care. And hopefully I get an opportunity in subsequent answers to provide a little bit more in terms of what we're doing in one-time funding for enhanced service delivery.
The honorable member for St. John's.
So, thank you for giving me those numbers. So, there's so many things here. Again, I know that the member kind of mapped out the dollars that the authority gets for its agencies, for the Southern Authority. I mean, we could go on for all of them, but let's just concentrate on the Southern Authority. But again, the directors that I spoke to just on Friday were saying that there were not preventative dollars, so that the province allocates. And then one of the other things, I'm trying not to conflate a bunch of different issues here, but one of the other things, so I'd like a little bit more information on this. One of the other things that they said, each of them consistently, talked about the wages that social workers get. And, they had indicated that, justice and health had got increases, particularly over COVID, to kind of, recognize the work that they were doing. But that their staff, they haven't gotten an increase in wages. And so, but I'm seeing here, you're saying that in 2023, 2024, there's a wage relief of $5.26 million. Is that new dollars? Like, was there wage relief or increases to their for their wages for their staff in previous years? Because like I said, I don't even know if that is the case, if they even know. And why I say that is that there's also what they raised consistently among them, that there was a disconnect in respect of communication between the Southern Authority and agencies, right? So consistently when we went around the table, they talked about preventative dollar. They talked about a lot of things that I have here, so we'll be here for a couple of hours, but they talked about a lot of things, right? Preventative dollars, blah, blah, blah. And consistently they all talked about wages, right? And what they said was that because their staff, their employees' wages haven't gone up, right? And certainly not in respect of inflation and all of the costs that we're all dealing with. What they're finding is that a lot of agencies, their staff are leaving. And so they're leaving for Jordan's Principle, right? So they mapped it out that, Jordan's Principle, they could go from like 35 to 40 caseload at their current agency, making, not a significant amount of dollars. And again, those increases haven't increased, and go to Jordan's Principle and have a caseload of 15, but also have wages that are, significantly higher than what they're paying now. So that's a lot to say. There seems to be something's disconnected. Something's disconnected between the directors that are doing this work and are on the front lines from what we're being told here, particularly in respect of wage relief. So I wouldn't mind to understand that a little bit more, whether or not these are new dollars, like new wage relief dollars for this fiscal year, and they just haven't been told yet and it's coming down the pipe. But then again, really to kind of map out the preventative dollars that agencies get from the 170 for this fiscal year or in previous years. Yeah, true.
The Honorable Minister of Families.
So in both cases, these are new dollars. So it certainly could be a situation where the authority hasn't received the money and then hasn't communicated it to the CFS agencies, but we anticipate that that will be forthcoming. This year, starting in this fiscal year, which began the beginning of this month, a total of $27 million in new money was committed towards supporting the sector. And so what that meant is that in salary and operations, and this money will flow in May, Southern Network will get the 3.5 million, the Northern Authority will get 1.8 million, the Métis Authority will get 0.8 million, and the General Authority will get 0.8 million. And then those are annualized funding. So that's built into the budget. Each year they will now receive those additional monies in their allocation. But what we did do as the one-time relief in recognition of the need for recruitment, retention, stabilization of the sector, and the great strain that the sector had experienced during COVID, as did many sectors, we wanted to also provide one-time relief. And this money is flowing this week. And that includes $5.26 million for the Southern Network, $2.6 million for the Northern Authority, $1.8 million for the Métis Authority, and $1.2 million for the General Authority. So those dollars are flowing as we speak. And of course, that is that one-time wage relief funding. From the province, it goes to the authorities and then is distributed down to the agencies. And so I certainly do hope that the frontline workers, who definitely do deserve this recognition, that they receive this one-time bump in the next few days, and that in May they see that they've also received that ongoing increases based on that commitment that our government had made to the sector and all of its employees.
The Honorable Member for St. John's.
I appreciate that. It seems to me like there's a disconnect in respect of information flowing, right? Which is actually quite concerning if you think about it, right? Like the authorities were established to be that in-between, or that conduit between agencies that are on the front line and government, right? Somewhere along the way, there seems to be a disconnect, and potentially, or, I'm trying to be very careful in my wording here, but, some lack of communication, right? Because this was only 3 days ago, right? And they hadn't heard about this. So I'm curious in respect of, like, what are the mechanisms of accountability, right, from the province, or between the province and the authorities, so i.e. to ensure that there is a proper flow of information and a proper flow of communication, but also vice versa, right? So when agencies have issues, which was something that we also heard, they're forced to go to the authority. But there were some concerns on whether or not their concerns actually make it from the authority to the minister's office. So I'm curious on how some of that kind of operates, because here's a clear example. And my colleague from Kiiwetinoong was at the meeting with me as well, and he can back up that literally just on Friday, they had nothing, they didn't have any of this information. So here's a clear example of a lack of communication. So again, in respect of accountability and ensuring, that everybody is doing their job that they're meant to be doing.
The Honorable Minister of Families.
So I will certainly be the first to admit that we don't have the clearest line of sight into the agency operations as per devolution. We do have the relationship with the authorities. And so right after the budget was tabled, we did inform all 4 authorities of their new allocation, which included these increased dollars. And then they in turn have the responsibility of working with their agencies. They are still in the process, perhaps, of determining their allocations to each agency. And so they will be reporting back to us by the end of June on how they have allocated these additional monies and how that they have applied them to their salaries. But we have issued the directive that they must include a 5.66 increase to their sector employee salaries, and they need to confirm and report to us by end of June on how they've accomplished that. Yes.
The Honorable Member for St. John's.
Yeah, so coupled with what I just said in the previous question, one of the things that folks were saying around the table as well is that, again, I guess I'm really trying to stress that there's a disconnect here. So often, more often than not, agencies, it will be April 1st, and they don't have any clue what their budget is for the year, right? But they're required to do their own budgeting, right? And figure out what they're going to be doing. And often they're not advised of what the dollars that are going to be flowing to their agency until months later in some cases. So it makes it so that they're not able to properly plan in respect of that fiscal year for themselves. So I share that because I think it is important to know, right, that often they don't know what their budget is, which then I would submit then has an impact on a direct impact on the work that they are able to do or wanting to do when you don't have that information. So I think that it's perhaps something for folks, for everybody around the table to be aware of, that there is this disconnect, and that it does impact on the work of social work or child welfare. So to go back to prevention dollars, because I know that, and I appreciate the minister, mapping out and really taking the time to share in respect of all of the dollars. However, I haven't heard, unless I've missed it, which I could have, I haven't heard specifically out of this 170, out of the 27 million of new monies, what specific allocation is towards preventative dollars?
The Honorable Minister of Families.
So in total, we give each year $421 million to the four authorities, and now if we include PEGWIS, the four authorities and the one Indigenous governing body. And this year alone, there was an increase in the $27 million, but to address some sector stabilization dollars and inflationary dollars, but there is discretion in these envelopes to do preventative work. There is not a prescriptive line item from the province on mandating certain dollars be put towards preventative. We provide the authorities, who then in turn provide their agencies the dollars based on these envelopes. And apart from the sort of mandate for wage relief and salary dollar increases, we don't prescribe how those additional dollars are spent.
The Honorable Member for St. John's.
Okay, just quickly, clarification. I know you said, the minister said 421 for all four authorities, but the 27 million for new money is just for the Southern Authority.
The Honorable Minister of Families.
So the 421 million is the global figure for the four authorities plus the one Indigenous governing body. This year we increased $27 million across the four authorities.
The Honorable Member for St. John's.
So perhaps I recorded this wrong. When you were giving the numbers for the Southern Authority, you had said like 174, and then you said, I can't even read some of my writing here, but like 3.5 increased salary, 1.4 national standards, 10.6 million for something that I don't know what the heck I wrote there. But that was for all of it, like the global? I'm getting confused now. Okay.
The Honorable Minister of Families.
I apologize. I will clarify. So the global is 421, and the global amount of new dollars committed to supporting the child and family services sector was 27 million. Of that 27 million, 18.36 million went to the Southern Network. 8.8 million went to the Northern Authority. 4.78 million went to Métis Authority. And the General Authority is, well, they had a surplus, so they didn't get any new dollars. And I can elaborate on that in my, well, where that comes from is they had to transfer out $4.3 million from the General Authority budget into the Indigenous Authorities budgets because they have fewer kids in care, because if a child comes into the General Authority but is appropriately belongs under the Southern Network, the child is taken into the General Authority, is counted, and they receive an allocation. Then the child moves out of the General Authority, and we reconcile the dollars to make sure that the dollars flow with the child, but there's a little bit of a lag in that reconciliation period. And so that reconciliation for this fiscal year was $4.3 million. So they did not, it turned out that General Authority did not receive new monies for reallocation from the case transfers.
The Honorable Member for St. John's.
Okay, bear with me here. $27 million new money overall. 18.3 went to the Southern Authority. 8.8 went to the Northern Authority. 4.7 went to MMF, and nothing went to General. But that's over 27 million. It's 31 million. It's $31 million 800.
The Honorable Minister of Families.
So $27 million is the increase, but the reason the number that you're adding up totals 31 is because 4 million was subtracted from the general authority. And I apologize, I'm really trying hard not to be confusing, but it's because of the reconciliation work that gets done at the year end. And we want to make sure that if a child comes into the general authority and then transfers out, that those dollars flow to the Southern, the Northern, or the Métis Authority. So 27 in new money from the province, and $4.3 million was subtracted from the general authority and redistributed to the Indigenous authorities. And that's why we have the increase totaling $31 million for the 3 Indigenous authorities.
The Honorable Member for St. John's.
Okay, just give me 1 minute here. My son is in school to become a math teacher. I probably need him here right now. Yeah, where is he when I need him? Okay, to be clear here, unless I'm doing something wrong here, 18.3, 8.8, and 4.7 comes up to 31.8. That's not including the 4.3 to the general authority. Unless I'm doing something wrong here, and I can probably text my son, but because the 4.3, I didn't even include the 4.3.
The Honorable Minister of Families.
May I suggest tabling this for the members' review?
Please, and I will give it to my son right away.
You can simply mention that you are tabling it, Minister.
So I would like to table the chart labeled Components of Single Envelope Funding, Child Maintenance, Agency Operations, and Authority Operations and Salaries for the committee's review.
The Honorable Member for St. John's.
This is like when we were trying to figure out the $200 for young adults, and so again, clear as mud right now. So, oh boy, I want to talk a little bit about the young adults, and so I want to understand how is it determined that a young adult, what's the process, how it's determined, what are the supports that are offered in these like post-majority agreements? I don't think that's called, they're called young adult agreements. What's the process for that? And in respect to the dollars, I know that the minister previously said that there's a 2.5 increase, or is that new dollars for young adults? And whether or not at this point the minister or the department or the authorities feel that that's enough financial support, and certainly in respect of other supports for these young adult agreements.
The Honorable Minister of Families.
So on the sort of global picture of youth aging out of care, we certainly do agree that much more work needs to be done to support youth who are coming out of care and to transition successfully into adulthood. And as any parent around this table with adult children, we know that it takes a lot sometimes to launch a child. And those supports at times were not being received by children in care, and that much more work needs to be done to support the transition from adolescence to adulthood for kids who are in care. So some of the measures that we've done in recent years and particularly COVID taught us a lot of lessons about the perils of aging out of care. So we had made available $7 million to enhance supports from youth to ensure that they didn't have to age out of care. And we extended those supports. Those were between the ages of 21 and 26. Prior to COVID, there were no such supports for children at the age of 21. And so we now have annualized that, and that's where that $4.67 million comes in, so that any kid aging out of care can establish care services that would be provided through the AYA agreement, which is the Young Adult Agreement. And so that has been formalized to support kids up to the age of 26. We also recognize that not every kid coming out of care, some kids when they reach the age of 18, they don't want to be a part of the system. So and some kids who have been on an AYA agreement from 18 to 21, but then they reach the age of 21 and they want to be move on from the system, and they don't want to extend that AYA agreement. And there was definitely a gap in service delivery for reaching these kids. So we've established these youth mentorship hubs. We are going out into an RFP right now to establish them, particularly in rural and northern Manitoba, where we can have, if you will, a one-stop shop for a kid who was in care, who can go somewhere and talk to somebody who is not affiliated with the CFS agency, separate and apart from CFS agency, getting provincial dollars to work directly with that youth to help them access services, find housing, apply for benefits. And then the other thing that is available to any kid who has exited CFS care, or in even with an AYA agreement or without an AYA agreement, is what's called the Canada Manitoba Housing Benefit. It was last year a $250 a month portable shelter top-up fund. We enhanced that to $350 starting April 1st. And so what that means is any kid who was in CFS care can apply for this benefit and receive that to go towards their shelter benefit. The problem is the program was undersubscribed, which meant we need to do a better job of putting information out there so that kids exiting out of care can access the services that they're entitled to and to get the benefits that they're entitled to. And so there's a collection of work that's being undertaken right now to really support kids up to the age of 26 who have been involved in the CFS system. Is there more work to do? Absolutely. I also was remiss in elaborating a little bit on some of the preventative work that we're doing. And while we don't have the specificity in the agreements that we have with our authorities based on single envelope funding, they don't have the prescriptions from the province to spend X amount of dollars in various categories apart from their wages. We invest in preventative care outside of the allocation to the families. And so some of the other initiatives that we're doing is we established the Second Granny's House site. We fund the Super Dads program through Mount Carmel Clinic. We are providing naloxone kits to many of our service providers within the CFS and the CLDS system, and respite, other respite initiatives.
The Honourable Member for St. John's.
I'm curious about the Canada Manitoba Housing benefit a little bit more, because it's the first time that I've heard about it. And certainly people need it, right? So, which I'm gonna share on my social media, because I think it's really important to get that information out there. So I appreciate that the minister and the department know that there's probably some more work to do there to get that information out. So youth who had been in care or are currently still in care with an AYA or not can apply for this benefit, or is it that they're just completely out of CFS care? So just a little bit of clarification. That's $350 per month to help subsidize their housing needs, their rent. That $350, if they're on social assistance, does that claw back any dollars that they would get?
The Honourable Minister of Families.
Well, I appreciate that the member is going to help spread the word about the Canada Manitoba Housing Benefit, and she will certainly be doing it in real time as we're announcing this. We do have the allocation approved to go up to the 350, but apparently we haven't announced it yet, so we'll be doing that tomorrow as well. So we can do it simultaneous, that's no problem. So prior to our announcement, like last fiscal, it was 250, we bumped it up to 350. So just to clarify, any kid who reaches the age of majority, 18, they are now legally, they're classified as having exited care. irrespective of whether or not they have an AYA or not. Some kids at the age of 18 enter into an agreement, but there's still a kid who's exited care and now are on an AYA agreement. And then there are other kids who have exited care and don't have an AYA agreement. Both classifications are entitled to this Canada-Manitoba housing benefit of $350 effective April 1st, retro to April 1st. And there is no EIA clawback, but it doesn't exceed your rent. So for example, if you are living in a place where your rent is $800 and the discrepancy between what you receive in your rent from EIA and the amount that you would receive under this $350, if it exceeds the amount that your rent is, you only get up to the amount of what your rent is. But if you are living in a place with a higher rent charged and your rent is $350 more than what you're receiving from EIA, you get the full benefit to take you up to that level.
The honourable member for St. John's.
So the announcement tomorrow is that it's gone from $250 to $350. Okay. And I'm on the website now because I'm very excited about this. Where's the application? I don't see necessarily, hold on. Okay, here we go. Okay. Okay. Okay, well, like I said, I think that that's actually important information to get out to folks who are, like I don't think we need to, get into a great length of discussion about how hard it is to find housing right now, right? So I think that that is really important issue. And like I said, on the there's actually 3 streams. So each of the 3 streams are actually equally important, right? People at risk for homelessness and mental health and addiction. So that's good to know. I'm glad that I was able to find that out today. And so from what I understand then, there's kind of like once you're 18, is there 2 types of streams? So 18 to 21 and then 21 to 26. So two different streams of. Now, the 21 to 26 is an AYA. Is the 18 to 21 an AYA as well?
The Honourable Minister of Families.
So when it comes to the AYAs for kids exiting care between the ages of 18 and 21, they are receiving money from the province under the CFS Act. The CFS Act does not allow currently to flow money to kids who have surpassed the age of 21. So when we found ourselves in the middle of the pandemic, we really wanted to flow supports to kids between the ages of 21 and 26. And so what we did is we formalized an expenditure under the Emergency Measures Act to support them. And that's where we flowed $7 million during the course of the pandemic. Now what we've done, for expediency purposes, until we change the CFS Act to allow supports to flow to kids, to young adults up to the age of 26. What we're doing now is providing grants under the Social Services Administration Act, and we call the funding envelope for young adults between the ages of 21 and 26 supports for young adults. So that is why there is the differences in the two different agreements for supporting young adults exiting care.
The Honourable Member for St. John's.
I appreciate that clarification because I was seeing the supports for young adults, but I was getting confused between the supports for young adults and then the AYA. So that makes a lot of sense that that it's a different flow until the CFS Act is changed. So is there any intention of bringing forward that bill anytime soon to make that change in the CFS Act?
The Honourable Minister of Families.
So we do have a very robust amendment package before the House right now that I'm very hopeful, I'll do a plug right now, hoping for unanimous support of that bill before we lift in June. And then there are certainly subsequent amendments to our CFS Act. I meet regularly with the Leadership Advisory Council, which is comprised of members from the Indigenous agencies, and I'll tell you
Order.
more about that tomorrow.
The hour being 5 p.m. Committee rise.